Hey everyone, I'm Dr. Yao. In my clinic, I see this scene play out all the time. A patient, recently diagnosed or maybe already going through chemo, sits down across from me, clutching a thick stack of medical records. They look at me, start to say something, stop, and then finally work up the courage to ask, "Doctor, I really want to try herbal medicine to support my body, but my oncologist told me, don't touch Chinese herbs. He said they'll clash with my medications, spike my liver enzymes, and might even cancel out the chemotherapy. Is that actually true?" And every time I hear that, I can see the anxiety in their eyes. On one hand, they're struggling, nausea, vomiting, numbness in their hands and feet, terrible sleep, and they're desperate for some relief. On the other hand, they're terrified that one wrong move could interfere with their Western treatment and make things worse. So in today's video, I want to give you a clear science-based answer to that exact question. If you're undergoing Western medical treatment, can you safely take Chinese herbal medicine? And what's the real truth behind this idea of clashing? First, let's clear up a common misconception. A lot of patients assume Western medicine kills cancer cells. So does Chinese medicine also try to kill cancer cells? If both sides are attacking, will my body be overwhelmed? Here's the thing. In modern integrative oncology, when you're undergoing chemo, radiation, or targeted therapy, the role of TCM is usually not to join the frontline attack. Instead, it acts as your logistics and repair crew. There's a core principle in TCM oncology called reduce toxicity, enhance efficacy. Here's what that means in practice. Chemotherapy drugs are like powerful explosives. They destroy cancer cells, but the blast inevitably hits surrounding healthy tissue too. Your bone marrow, your gut lining, your hair follicles. That's where TCM steps in. The herbs we prescribe are designed to protect your bone marrow so your white blood cell count doesn't crash, settle your stomach so you can actually eat, and improve circulation to relieve that tingling numbness in your hands and feet. So this isn't two armies fighting each other inside your body. Think of it this way. Western medicine is the combat unit on the front lines. TCM is the team outfitting you with body armor and keeping the supply lines running. A really common example. Many patients see their liver enzymes, GOT, GPT, rise after chemo. At that point, the oncologist might pause treatment to protect the liver. If you're already on a properly prescribed TCM formula, certain herbs like Schisandra berry and Buplurum used in the right combinations can actually support liver recovery. The real risk isn't TCM and Western medicine can't be combined. The real risk is taking random supplements without professional guidance. Now you might be wondering, okay, I get the theory, but inside my stomach, won't the herbal tea and the pill still react chemically? That's a completely valid scientific question. To minimize that risk, there's one golden rule you need to remember. Always space them at least 1 to 2 hours apart. Why? Two main reasons. First, acid-base interactions. Some herbs contain organic acids or alkaloids. If taken at the same time as certain medications, they can shift the pH of your stomach, causing your Western drug to be absorbed too slowly or too quickly. Second, physical coating. Some herbs, particularly richer, more sticky tonics, can coat the stomach lining. While that's protective for the gut, it can also wrap around your medication and prevent it from being properly absorbed. So here's the practical approach. Let's say you take your Western medication, chemo pill, or targeted therapy at 8 m. Schedule your herbal medicine for 9:30 or 10 m. Give the Western drug time to dissolve and enter your bloodstream first, then the herbs come in. That simple 2-hour gap dramatically reduces the risk of interaction. One more important flag. If you're taking blood thinners like warfarin or aspirin, or if you have surgery coming up, certain blood-activating herbs like angelica root, ligusticum, and salvia need to be paused or reduced as they can increase bleeding risk. This is exactly why you need a qualified TCM physician, not a trip to a random pharmacy. A trained doctor will see your medication list, automatically avoid anything that elevates bleeding risk, and find safer alternatives. That's the value of professional care.
I want to talk about something that doesn't get discussed enough, the psychology of all this. So many patients come to me in secret. They're scared their oncologist will scold them if they find out about the herbal medicine. So what happens? They go in for blood work. Liver enzymes are slightly elevated. The oncologist asks, "Have you been taking anything?" And the patient, feeling guilty, says, "No, nothing." The doctor naturally starts looking for possible interfering factors. If the patient has been secretly taking herbs and doesn't say so, it's easy for everyone to assume the worst. The patient goes home and throws out their herbal medicine. This is a destructive cycle, and it's completely avoidable. My advice? Be open, be transparent. You can calmly tell your oncologist something like, "Doctor, the chemo side effects have been really hard on me. My energy is very low. I've been seeing a licensed TCM physician to help manage my appetite and sleep. I've given them my full Western medication list, and we're strictly following the 2-hour spacing rule." Most reasonable oncologists, when they hear licensed TCM doctor and 2-hour spacing, will actually soften their stance. Some will even be supportive because they know that if you have more energy and can tolerate treatment better, you'll be able to complete the full course of Western therapy. And if something like abnormal liver or kidney function does come up, transparent communication means everyone can objectively assess what's actually causing it. Is the chemo too aggressive? Is it disease progression? Or is a particular herb not suitable? That's how you make the best decisions for your health. To everyone out there on this cancer journey, I want to leave you with this. TCM and Western medicine are not enemies. They are the left hand and right hand of your fight against this disease. Western medicine delivers precise, targeted strikes on the front line. TCM reinforces your vital energy from the rear. Just follow these 3 principles. 1. See a qualified TCM physician. No random folk remedies or mystery supplements. 2. Strictly follow the 1 to 2 hour spacing rule. 3. Stay honest and open with your entire medical team. With these in place, integrating TCM and Western medicine is not only safe, it's 1 + 1 is more than 2. I hope this video has put some of your worries to rest. In our next episode, we'll talk specifically about how ginseng is used during cancer treatment. And if you have a specific question about combining a particular targeted therapy drug with herbal medicine, drop it in the comments below. We might just make a dedicated video about your question. I'm Dr. Yao. We're here to help you walk this road steadier and farther. See you next time.